Hi, this is my medical mystery, the man who had repeated seizures, memory loss, and wild mood swings. Willie Rice, a 46-year-old veteran from Vado, NM, who suffers from constant seizures resulting in memory loss and mood swings. Summary from medical mystery. Army veteran who has experienced troubling symptoms. He is dealing with memory loss, impaired hearing, dizziness, and exotic emotions. Symptoms began after he had a seizure and had become difficult to manage. Doctors were unable to diagnose him. Summary of medical mystery. Doctors had no possible explanation for symptoms. Medical tests indicate he had unexpected brain inflammation. He and his wife, Sandra, turned to Netflix series Diagnosis for assistance. The show introduced them with people who experience in identifying and living with golf or illness. The symptoms and patient's medical history. A combination of symptoms can indicate various neurologic or psychological conditions. It could be difficult to pinpoint the exact cause of the symptoms. He was experiencing repeated seizures, memory loss, and wild mood swings. Could be associated with conditions such as epilepsy or mental health conditions. Various neglected conditions encompass a wide range of disorders affecting the nervous system. Common neglected conditions are Alzheimer's disease, a progressive disease that destroys memory and other important mental function, a migraine, a headache of varying intensity, often accompanied by nursing or a sensitivity to light and sound. There are a few examples of neglected conditions. It is important for individuals to seek medical evaluation and appropriate management. Psychological conditions, mental health disorders, or physiological disorders refer to a broad range of conditions that affect overall mental well-being due to a variety of reasons. Some examples are mood disorders, a mental health condition that primarily affects your emotion state. Psychological disorder involves dispute in thinking, perspective, and behavior. Can include conditions such as schizophrenia. It's important to note that psychological conditions are vary widely in terms of symptoms, severity, and response to treatment. Early interventions and access to appropriate care are essential for improving outcomes and enhancing the quality of life of individuals affected by psychological conditions. Medical terminology. Gulf War illness, a permanent condition affecting Gulf War veterans in a cluster of medically unexplained chronic symptoms. Gastrointestinal, relating to the stomach and the intestines. Neurologist, a medical specifics in diagnosis and treatment of disorders of the nervous system. Seizure, a sudden attack of illness, especially a stroke or an epileptic fit. Cancer, a disease caused by uncontrollable division of embryonic cells in a part of a body. Antibiotics and medicines such as a penicillin or that inhibits in the growth or destroys microorganisms. Medical terminology. MRI, a non-virus medical image test that produces detailed images of almost every internal structure of the human body. Autoimmune disease, a disease in which the body immune system attacks healthy cells. Multiple sclerosis, a disease in which a human immune system gets away with at the protective covering of nerves. Lupus, an illness that covers when the immune system attacks healthy tissues or organs. Oncologist, a doctor who treats cancer and provides medical care for a person diagnosed with cancer. Pneumonia, infection or inflamed air bags in one, both, or lungs, which may fulfill the fluid. Medical terminology. CPR is used for circulate blood to the brain and other vital organs. Stroke occurs when someone blocks blood supplies. Capra used to treat certain types of seizures. Marion's disease, a disease of the inner ear that could cause a person to get dizzy and have trouble hearing. Tuberculosis, an infectious bacterial disease characterized by tuberculence in the lungs. Lyme disease, a tick-borne illness caused by bacterium Borrelia Possible causes. The impact of the war Willie Rice's illness can manifest in several ways. Here are some possible potential ways in which the stress and trauma of the war could affect his illness. Post-traumatic stress disorder, could also known as PTSD. If he experienced combat, witness violence, or losing comrades, he may have developed PTSD. Symptoms of PTSD include intrusive memory, flashbacks, nightmares, hypervigilance, or emotional numbing. Can cause severe memory loss and mood swings, making them feel frequent or severe. Traumatic brain injury, also known as TBI, can result in memory impairment. Mood disturbance and seizures. TBI can cause or contribute to his symptoms or the development of the new ones. Possible causes: mustard gas, also known as sulfur mustard, is a chemical warfare agent. Exposed to mustard gas can have severe, long-lasting effects on health, including both physical and psychological impacts. If Willie Rice was exposed to mustard gas, it could have contributed to his illness in several ways. Physical effects: exposure to mustard gas can lead to skin burns, eye damage, respiratory problems, and internal organ damage. In severe cases, exposed to mustard gas can be fatal. Psychological effects: 98% of emotional problems, 80% of behavior and formalism, 80% of memory impairment. Possible causes: the seizure he experienced could significantly impact his overall health and well-being. Examining his symptoms. Here's how the seizures might be caused of his systems. Memory loss: seizures can interfere with the normal functioning of the brain. Willie may experience temporary or permanent memory impairment. Difficult recalling certain recent events, conversations, or important details about his life. He might struggle with short-term memory loss. Memory tests such as reminding appointments, names, or everyday tasks. The memory loss can also affect his ability to learn new information or retain previous learned knowledge. Wild mood swings. Seizures can also affect emotional regulation and mood stability. Willie's mood swings may interfere with his ability to function in daily life. He may feel overwhelmed by emotions and struggles to manage his reactions to various situations. Mood swings could be also contribute to feeling frustration, isolation, and low self-esteem. These are the pictures from the article, the medical records, and then the illness and the issues, the lab results, more pictures, laboratory reports, test notes, and more laboratory reports. A lab summary. These are the rates and lab summary. Explain rationally. Willie Rice experienced memory loss common with seizures. Seizures affect the brain and can also damage certain areas like memory. Work can be cause of his symptoms. Work can be quite traumatic. It could be due to various reasons. Alzheimer's disease, while associated with memory loss, is out of the question since there is no indication of that. Explain rationality. While losing his hearing could be also due to age. At his age, he's no hearing issues, so that eliminates possible causes. Willie can get dizzy. This could be due to seizures, effect of the war, or high blood pressure. It could be diagnosed. It could be a disorder or illness related to the war as PTSD, or more due to the physical and physiology effect on the person. Gulf War illness, also known as GWI. Medically unexplained symptoms like fractured headaches, dizziness, respiratory disorders, and memory problems. He is an Army veteran, and documents of the war at that time were unclear. He suffers from seizures after being healthy his whole life. His high blood pressure, which he has control 26 of his congenital problems. Gulf War illness. At the age of 46, he has been suffering with symptoms, and the doctors have no answers. Willie and his wife turned to diagnosis for help. In the show, they discovered that the Gulf War illness, since he has a lesion of his brain, causes his symptoms. There they be introduced people who had GWI or Gulf War illness and how they cope with day-to-day life to help them live this. These are my resources I use. These are more of the resources I use. And thank you.